So hi, I'm Itai Klug. I'm a professor at Mount Sinai, the Department of Environmental Medicine and Climate Science. I'm an exposure scientist and GIS specialist, and happy to have you, Manish.
It's nice to be here. My name is Manish Arora. I'm professor and vice chairman of environmental medicine at Mount Sinai.
So Manish, the environment is constantly changing. How do you deal with this dynamic nature of the environment?
In a way, Itai, what I do is similar to what you do. You look at satellite data and go back in time. But for me, I was always interested in studying the molecular impacts of the environment, but not just at one point in time, but rather going back just the way you do with satellite data. And the fundamental reason is the same. What impacts our health, that environment is not from today. It's the environment over a lifetime that impacts whether we are healthy or whether we get sick. So in a way, that's always been the focus of my work.
So how exactly do you do that?
So the idea is extraordinarily simple. As a PhD student almost 20 years ago, I was looking at a tree that was cut down and I saw growth rings. And as I counted back, I noticed this ring that was quite skinny and garbled, and it hit me, oh, I'm going back in the history of this tree, but at each ring, there's a timestamp. And it suddenly clicked memories in my mind of my dad listening to Nat King Cole on a vinyl record, and it just occurred to me that so many things in our life record their history. And I realized that there's a tissue in the body, it's our baby teeth, that also have growth rings in them. And we learned how to open up baby teeth and use lasers to measure a whole range of chemicals along each ring. And the amazing thing about baby teeth is that they start developing before we are born. So every time a child sheds one of those 20 baby teeth, they're actually giving us fetal tissue. So this became something to me that was just amazing, that I'm getting fetal tissue non-invasively. And I can look back decades in a person's life and say, well, this is what was happening to you even before you were born. And that's where sort of the story started.
So Manish, how are you bringing that work to the clinics?
So that's a very good question, because we realize that baby teeth are a great tool for research, but they don't really work that well in the clinic, because obviously, you can't approach a child and just have a tooth from them whenever you want. So as we were tackling that problem, we realized that hair, just scalp hair, also have growth rings, and we can collect scalp hair almost anytime we want. So since then, we've been developing robots and lasers and other technologies to just reconstruct our exposure history from a single strand of hair. To describe it in simple terms, we can get as much information from hair as it would take about 500 to 1,000 blood samples to get that. And we are now applying it to study conditions for which traditionally there are no tests. Conditions like autism spectrum disorder, like ADHD or Lou Gehrig's disease. And in fact, we have FDA breakthrough designation in the US and CE mark in Europe for our autism biomarker, and very soon it will be available to patients. So this journey of 20 years, starting with looking at a tree and the growth rings, has led us to this tool that can actually help clinicians and bring precision environmental medicine to our patients.
So Manish, this is fascinating what you just discussed. Where do you see environmental medicine heading to, and what's on the horizon?
For me, this is a golden age for environmental science. It's a real privilege to be working in the United States with all the support from the public, from private funders, and from the NIH. What I feel is that we've reached critical mass, where technologies that you develop that study the environment outside our body. I recently spoke to our colleague Mayan, who's looking at environmental changes, climate change, and how it impacts cardiovascular disease. And to be able to link that with what I do in the lab using robots and lasers, and with the advent and the maturation of machine learning and AI technology, I just feel very soon every individual, every taxpayer who's funded our research will be able to get tools to improve their own life. And for me, that would be the promise of precision environmental medicine.
That's great. Thank you. It's always a pleasure to discuss with you. And
Thank you, Ita. Pleasure.